Hello and welcome to A Healthy State, a series where I talk to doctors and other health professionals about important health topics. I'm Dr. Nelu Simmons and thank you for joining me. In this episode, we will touch on what you can do to prepare if you're starting a family and where to turn to help for fertility issues. Now, a huge part of women's health is pregnancy and childbirth. And who better to chat to us about this than obstetrician and gynecologist Dr. Nisha Khot. Dr. Khot works at a number of hospitals and holds a coveted role in the training program for future doctors in her field. I'm delighted to have her join me in the studio today. Dr. Khot, thank you so much for coming in.
Thank you for having me.
Now, let's get started. Let's talk about getting pregnant. Not for myself, I've got 3, so that's plenty for me. But I'm sure there are plenty of viewers here who are in that stage of wanting to start a family. What sort of advice do you have for them?
So if anybody is thinking about starting a family, my first advice to them is, do you have a GP? If you don't have a GP, find yourself a good GP who you can trust, because that is the person who's going to be key to making all the plans for pregnancy and for your general health. It's really important to think about your general health, think about diet, exercise, things like that, because not to say that those are the things that will make a huge difference to how you get pregnant, when you get pregnant, but they are good things to get started on before you get pregnant. If you have any chronic conditions, for example, if you have diabetes or if you have blood pressure issues, those need to be well controlled going into a pregnancy. Because if you go into a pregnancy with your blood pressure all over the place, that's not going to be good for you. It's not going to be less stressful for you. So it's best to have all of these conditions optimized before you get pregnant. Other things to think about are whether you wanted to have any screening for genetic conditions. Now, in Australia, we're very lucky that we can screen for genetic conditions which are passed on from parents to their offspring. And the most common one that we screen for is thalassemia. The others are cystic fibrosis, Fragile X, and spinal muscular dystrophy. Your GP can talk you through these tests and arrange them for you. Some people will opt to have testing for both partners. Some will decide on having testing for one partner, and then if there's anything picked up on that test, then the other partner in the couple will get tested. Sometimes we can also do expanded genetic carrier screening for specific conditions that might run in the family. And so again, seeing your GP and someone asking you all of that relevant history is really, really important. Vaccinations. Again, one more thing that you can do before you get pregnant is to make sure that you are vaccinated. COVID vaccination, really important. But also thinking about vaccination against chickenpox. If you have never had chickenpox before, the last thing you want is to get chickenpox when you're pregnant. So really important to think about those vaccinations. Supplements are another really important thing. Folic acid, we know, makes a big difference to how babies develop, and the time it makes the difference is in those really early weeks of pregnancy when you might not know that you're pregnant. And so if you're planning a pregnancy, it makes sense to start on folic acid supplements. Generally, we recommend not a very high dose of folic acid unless you have a specific condition like diabetes when you need a higher dose. We recommend that you take folic acid for at least 3 months before you fall pregnant and continue taking it till you are about 12 weeks pregnant. So those are some of the things to think about if you're planning a pregnancy.
Now, just before we move on, you mentioned supplements while leading up to conception.
Yes.
And while you're planning a pregnancy. Is it important to continue this while pregnant?
Yes, so really important to continue, especially the folic acid supplements, at least until 12 weeks. But specifically for pregnancy, there are a few other supplements to consider as well. Iodine, and that is also recommended pre-conception as well as during pregnancy. Vitamin D, about 400 international units, is recommended daily for all pregnant women. For women who are vegetarian or vegan or have other dietary restrictions, it's important to think about things like vitamin B12, things like iron. So we don't routinely recommend iron supplementation, but a check of iron levels if they're low to supplement, but also specifically for people with dietary restrictions to make sure that they get enough iron. One of the other things that we talk about is fish oil supplements, especially for women who don't have seafood in their diet. We know that fish oil is quite important for them. And calcium supplements, again, especially for women who are not consuming any dairy products, it's important to have extra calcium in their diet.
Yeah, gosh, I guess, a lot of people fall pregnant accidentally without any of this planning. So ideally, the planning stage, even well before you're actually actively trying, sounds like it could be helpful.
Absolutely. I think in this day and age, pregnancies really shouldn't be unplanned. We have got all the tools and the ability to be able to plan pregnancy, and that it should be a planned process where both partners have an equal role in making sure that they go into the pregnancy prepared for pregnancy and in the best health possible.
While we're on that topic, actually, you mentioned both partners. Is it equally important for men to be thinking about this as well?
Yes, absolutely. Because one, as a support person for the partner who's getting pregnant, but things like smoking, alcohol, even if one of you, so if as a woman you are not smoking and not drinking, actually passive smoking does have an effect on pregnancy as well. And so this is a great opportunity for your partner to give up smoking if they are a smoker. So absolutely, having a baby should be in a stable relationship where there are two partners and you're planning a pregnancy. It should be about both partners. It's also about supporting each other. Mental health is so important in pregnancy and so important going into pregnancy. So it's really important for having that support of each other to go into pregnancy in a good mental frame of mind.
Yeah, absolutely. So that actually leads into my next question. When a woman or a couple finds out they are pregnant, what is the next step?
So once again, have a GP, see your GP, really, really critical to all care in pregnancy. So if you haven't thought about all of these things that we've spoken about planning into pregnancy, those are all things to think about when you first find out you are pregnant. One of the things I didn't talk about is cervical screening. Now, we know that cervical screening makes such a big difference. The cervical screening program in Australia has changed. It's no longer 3 years, it's every 5 years. So it's important when planning a pregnancy to think about cervical screening. But if you find that you are pregnant and overdue for cervical screening, there is no reason why you can't have that done when you are pregnant. Once you get pregnant, there are a few other things to think about as well. The most important one of those is Down syndrome screening. Now, different people will have different opinions on whether to get screened or not. But if you are going to get screened, or if you are unsure about getting screened, have a discussion with your GP. There are a few different options these days of having just a blood test alone or having a combination of a blood test and an ultrasound scan, and your GP can guide you through those decisions. Along with the Down syndrome screening, that early scan is really important to date pregnancy accurately, because then that has implications for what your due date might be and what care you might get in the first few weeks of pregnancy. Some women are at high risk of developing conditions like preeclampsia, and this can be picked up by your GP, and you can be started on low-dose aspirin. Low-dose aspirin works really well to prevent preeclampsia, which is a devastating complication of pregnancy, and it needs to be started somewhere around 14 to 16 weeks to be maximally effective. And so that is a conversation to have really early in pregnancy, because generally for most women, they wouldn't see a specialist or a midwife till they are beyond 12 weeks, sometimes beyond even 16 or 18 weeks. So it's really important to catch that key time to start the low-dose aspirin.
Now, you mentioned being up to date with immunizations is really important when trying to conceive, but let's just chat quickly about immunizations during pregnancy. Now, I had the booster shot for the whooping cough, I had the flu shot, I had the COVID shot. You know, I'm a stickler for vaccination, so I made sure I got everything during the pregnancy, but I can understand that there's quite a bit of anxiety out there in the community about immunizations in general, but also during pregnancy, how that might impact the baby or the mother during pregnancy. Are you happy to go into that a bit for us?
We have lots and lots of evidence now on the safety of vaccines in pregnancy. And so I would really reassure women who have any concerns about safety of vaccines. Vaccines are very, very safe in pregnancy. In fact, getting something like flu in pregnancy is the more dangerous thing. Getting something like COVID in pregnancy is the more dangerous thing and is associated with poor outcomes for mums as well as babies. Whereas vaccination reduces all of those poor outcomes, whether they be preterm birth, whether they be stillbirth, whether they be ICU admission for mum. So absolutely, please get vaccinated. The flu and COVID vaccine can be had any time in the pregnancy. The pertussis or the whooping cough vaccine is usually given after 20 weeks.
Thank you for highlighting that, because I'm a stickler for vaccination, so I'm glad that we've managed to get that message out. Now, on the flip side, a lot of women struggle to get pregnant. I myself went through fertility battles, and I know it's really hard. Can you tell us a bit about what some of the common causes of infertility are that you see in our population?
Yes. I will start by saying that, again, just like pregnancy, fertility is about two people. And when we look at the statistics across the board, what we see is that a third of problems with getting pregnant are down to things that might be a problem with the woman. A third of problems are problems that might be to do with the man. And a third of problems are to do with the couple, or they might be unexplained. So it's really important to take it away from being something that affects women to something that actually affects the couple. What are some of the causes of infertility? So from a woman's point of view, some things need to happen to be able to get pregnant. One is that your ovaries need to produce an egg every month. Your tubes need to be open so that the egg and the sperm can meet to form an embryo. And the most common causes usually tend to be either something to do with the tube or something to do with the ovary. So if your ovary is not producing an egg every month, obviously there isn't an egg, you won't get pregnant. And some of the conditions where that might happen is one of the most common ones called polycystic ovarian syndrome, where your ovary doesn't release the egg and so you're not ovulating. The other might be something called premature ovarian failure, which sometimes doesn't get recognized until there are some investigations that are done. It just means that your ovaries generally get to menopause at around 50s, but in some women that might happen earlier, and that might be a reason why eggs are not produced every month. The other cause is the tube. The tube might be blocked, and the most common causes we see of that happening are things like endometriosis. I'm sure most people have heard of endometriosis these days, but the other common conditions are infections, especially sexually transmitted infections, which can really block the tubes and mean that that embryo then doesn't form because the egg and the sperm can't come together. So those are some of the common causes of infertility.
Great, thank you for outlining that. Now, when should a couple seek extra support? Is there a sort of a time frame that you think is a good time, and who should they speak to first?
First of all, they should speak to their GP. We keep coming back to the importance of GPs. I had a suspicion you would say that. Generally, we say that for most couples, once they start trying to get pregnant, if they are not achieving pregnancy within 12 months, then they should seek help. However, a provisor to that is actually the age of the woman. We know that as women age, their fertility drops and the number of eggs within the ovary drop. And so for older women, women over 35, it would be reasonable to seek help earlier. And that might be at 6 or 8 months of trying to get pregnant. For the vast majority of people, 12 months is appropriate.
Before we go on, I want to ask you a bit about infections in pregnancy. As a pediatrician, I see newborns who have contracted infections throughout the pregnancy or the childbirth process. Can you talk us through some of the important ones that we need to know about?
Yes, so first of all, when you get pregnant, your GP will organize testing for some of the very basic infections for all women who get pregnant. This includes HIV testing, testing for syphilis, testing for hepatitis B and C, and also testing to see whether you are immune to rubella or not. The one specific infection that is really important to talk about is CMV or cytomegalovirus infection. This is an infection that can really have devastating consequences for the baby if mums get it in pregnancy. The way mums would get it is through the urine and saliva of their toddlers, because the toddlers are the ones who carry the virus, and that's how it spreads. Really important for women who are planning a pregnancy or are pregnant to make sure that they avoid contact with a toddler's saliva or urine. When they change nappies, really important to have really good hand hygiene. Things like sharing spoons and sharing, I've seen mums do this in the supermarket. The baby's dummy falls out and they pick it up and, put it in their own mouth and then put it in the baby's mouth. That's the sort of thing that increases the risk of getting CMV infection. And given that it can be prevented with simple measures, I think it's really important to talk more about it with women who are planning pregnancy or who are pregnant.
Wow, we covered so much in such a short time. Thank you so much for sharing your expertise. I'm sure that the viewers got a lot out of that. So I really appreciate you coming in today.
Thank you very much.
It's been great to chat.
It's been really good.
Thank you for watching A Healthy State. I hope you found the information helpful. This episode and the rest of the series is available to stream on CTV+. I'm Dr. Nelu Simmons, and I'll see you next time.